Now we will see the difference, procedure, pros and the cons of CT scan and MRI, and neuroradiology ordering guidelines for common complaints or common suspected problems and what to order. Let's start from the difference between an MRI and a CT scan. Both MRI and CT scan are medical imaging methods that are used to create images of internal body to help diagnose a range of different medical conditions. The main difference between these two diagnostic imaging techniques is an MRI uses strong magnetic fields to take images, while a CT scan uses X-rays. MRI stands for magnetic resonance imaging. This machine then uses radio waves that bounce off fat and water molecules in your body, and these signals are sent to a computer to create an image of the affected area. CT stands for computed tomography. This machine uses X-rays to take cross-sectional image of certain body parts from different angles. These 2D images are then sent to a computer where they are transformed to 3D images. And when we see the procedures, the process for both procedures is similar. The patient will be asked to lie down on a bed that will then slowly and automatically slide into the circular scanner. The main difference between the two procedures is that a CT scan is much quieter than an MRI. MRI scans are noisy, and to manage this, the patient will be given earplugs and headphones to listen to relaxing music during your scan. An MRI scan might take around an hour to complete, whereas CT scan take as little as 10 minutes. When we see the pros and the cons of each, starting from MRI, the advantages of MRI include scans produce more detailed images, and the scan of MRI do not use radiation. MRI scans create loud noises, which some people may find stressful, and then metal objects, jewelry, and clothing must be removed before the scan. When we came to CT scan are less expensive than MRI scan, and CT scans don't last as long as MRI scan, and can be used for speedily diagnosis in emergency situation. A CT scan involves a small dose of ionizing radiation, so there is a very small risk this could increase your chance of developing cancer later in life. CT scans are not usually recommended for pregnant women unless in an emergency. The next is Neuroradiology Ordering Guidelines. What to order for what? For headache, CT head without contrast for acute headache, and MRI without contrast for protracted headache. For trauma, CT head without contrast is important. And if we suspect concussion or traumatic brain injury, MRI without and with contrast. For suspected intracranial hemorrhage, CT head without contrast should be done. For acute neurological changes, CT head without contrast, only if concerned for intracranial hemorrhage, and the subsequent stage include MRI with and without contrast. For acute stroke or TIA, CT head without contrast if candidate for thrombolysis, and the subsequent studies are brain MRI with and without contrast. In the case of hydrocephalus, if concerned for shunt malfunction, CT head without contrast. Alternative for more acute process include MRI with and without contrast. For seizure, for first seizure, MRI brain with and without contrast, and the CT head if patient is unstable or concerned for intracranial hemorrhage. For dementia or memory loss, MRI brain with and without contrast, and the hippocampal volumetric should be done. For suspected mass, MRI without and with contrast. For infection, MRI without and with contrast, and if that's not possible, CT scan without and with contrast. For pituitary dysfunction, MRI brain with and without contrast according to pituitary protocol.